What I've learned from our patients is that they want the same things that I want. They want to be cared about, they want to be loved, they want to feel needed, to be understood, to be listened to, that we're there for them, and that they're not just another patient. It's not so much about me, the nurse, and you, the patient, but it's more that we're in it together to help make better outcomes. It's critical to be a compassionate caregiver. We couldn't do our work without compassion.
I think the ability to be compassionate is within all of us. It's very human. There was a lot of families whose kids had been given very poor prognosis and need help in a very different way than they could get from our present healthcare systems. So we have to start looking at ways to just improve their quality of life, even if we can't cure their condition. Any day that you can make a better day is just a huge thing that you can give as a gift. And so the entire goal is just to make each day count for the child and for the family. It's just basic human need to know that the person that you're trusting your health to actually cares about you. They are the most courageous people I've ever met. They're my heroes. They don't know that.
The most important thing that I can do in my position is the art of listening. Because sometimes if there's nothing else you can do, you can listen. And sometimes that's what people want, to be able to express their feelings, their fears, their concerns. It's not all about medicine. It's rewarding in more ways than clinical ways. Compassion is so important. It's a reflection of your caring. So if you really truly care, it just falls in place to be compassionate and kind. And everybody deserves that.
To provide compassionate care means to have the ability to sit and be authentic with that patient and that family in that moment. And it's really just such an honor that they allow me to be a part of their journey. My job is really to be present and compassionate with everyone that I meet. I think I know that patients feel the compassion and the care that we provide, and you can see it in their eyes. You can hear it in their stories, and you can feel it in their hugs when they leave.
I take a lot of pride in what I do. If I didn't love doing what I do, it would never project to the patient that I really care about them and that I really feel compassionate towards them. It's not care unless there is compassion. If you can go in and be compassionate with somebody and really learn their needs and their wants and do the best you can to fulfill those and care about them and care about their family, then it's going to be a lot easier for them. Coming into the hospital is so hard. I mean, you leave your dignity and your control at the door. If I can make you feel like you still have some of that dignity and you still have some of that control, then I'm doing my job.
Medical relationships are simply human relationships, and if we treat them that way, I think it's quite easy to be compassionate and not be caught up in, I have to be the doctor and these are the parents or this is the patient, but that we're having a human interaction. It makes us a more human doctor. If we can teach people to be compassionate and non-judgmental and open to hearing family and patients' perspectives, we will go an enormous way in improving our medical care and our healthcare system.